I just want to thank you guys for meeting with us today. My name is Brett Gunderman.
And I'm Sam Thoenen. And a quick look at the current IT environment.
Employees spend an average of 1.5 hours a day inputting paper records into on-site terminals. There are 120 employees. An hour and a half a day for each of these employees equals 180 hours a day wasted on this action. Due to inefficient recording mechanisms and insufficient storage, TouchStone needs to adopt a cloud computing product.
And so a quick SWOT analysis of converting to a cloud-based system. There's a lot of strengths. We can still use the existing infrastructure. We're going to severely cut back on wasted time by employees. Each employee will save about an hour a day. And we're not going to need to hire any new employees to handle the cloud-based system because one of the strengths of it is that it's run by Amazon. Weaknesses: employees have no prior experience using the cloud, so we will have to train them a little bit for that. All patient information is going to need to be entered into the database, so that leaves room for human data entry, errors, and then new mobile devices are going to need to be purchased for people that don't already have a mobile device. And there's possible pushback from employees who rely too heavily on the old system. And business operations can't stop while we develop this, so parallel implementation is going to be necessary. Next, the opportunities. Because IT cloud services are competitive right now, we could get a good price by making the vendors bid on our project. Next, if application software is designed correctly, the billing could be done as the treatment is taking place, which just makes it even more efficient. Next, employees will have full access to patient information on site, so they can get treatment done more quickly without having to wait for communication to get through. Could get sponsorship for the mobile device purchase because of the competitive market. And then we will not need to have any on-site storage for physical or digital because of the cloud for patient information. And then due to the mobility of the devices, the treatment can be done off-site, maybe at a doctor's home, or he can visit the patient if they're in too serious of condition to travel to a hospital. And then threats: because of confidentiality of patient information, data security is going to be a huge issue. And so if the network goes down, employees will still need to know how to manually log appointment info. And then sites with bad connection to network are going to need to be fortified.
Now, our recommended software selection is Amazon Simple Storage Service, also known as Amazon S3. First of all, it's highly scalable, meaning that if we need to scale outward or inward due to an increase in employees or clients, we can do that. Also, as mentioned before, we have highly sensitive information, and security is a huge issue. Amazon S3 offers exactly the security that we need. Data can be securely uploaded or downloaded through the SSL encrypted endpoints using HTTPS protocols. There are also identity and access management policies in place. Those enable organizations to create and manage multiple users on a single Amazon Web Services account. Cost and monitoring control features. There are several, but the coolest one is CloudWatch, which allows employees to view real-time usage information and what costs are being added to your bill. Speaking of cost, most importantly, this software is very, very cheap. We estimate that it'll only cost us 7.5 cents per gigabyte of data storage.
And so moving on to implementation, timeline for this project to be implemented, the cloud provider Amazon gave us an estimate of about a month, and Idea to Appster, the mobile app developer that we're going to use, gave us an estimated time of a month as well. And we estimated that the employee training to use the mobile devices and the app and the cloud will take about a week. We estimated about 10 hours or so for that. And so if we begin this today, we can have this new system up and running in less than 2 months. And so TouchStone's biggest asset is its people, and so this is kind of our biggest argument for why this project should be undertaken. By utilizing Amazon S3 cloud storage, employees would save over an hour a day by eliminating the physical record keeping. And so for 120 employees, 1 hour a day is 120 hours the company saves each day. And the efficiency of saving those 120 hours is equal to adding 15 new employees. And so that is an incredible boost of efficiency, which saves up time for doctors, nurses, and practitioners, which frees them to be able to see more patients, and that just means an increase in revenue. Then moving on to the mobile app that I just talked about, Some of the requirements of it is it's going to have to be able to upload and download patient documents. That way, if a doctor gives an x-ray to a patient in one state and maybe another part of the state wants to analyze that x-ray, or maybe a nurse wants to do the billing or something like that, that's going to be able to support that. Patient information is going to have to be secure, and it's also going to have to be iOS and Android compatible. And Appster gave us a quote for $15,000 for all of those requirements, so we're going to move ahead with that, which brings us finally to the ROI. ROI that we estimated for this project is 2,750% return on investment, and we estimated that is on the low end of return. We tried to estimate the benefits by being low. We estimated using doctors working 40 hours a week, even though a lot of times they work more than that. I mean, I've heard of some doctors working up to 100, so benefits could definitely be higher than what we stated. And then costs, we also tried to project those on the high end of things, so that way, if there is one of those costs that we substantially underestimated, we think that the potential increase in benefit would more than make up for that miscalculation. And so, yeah, we think that this ROI and the reasons we already provided give great reason to undertake this project. And we want to thank you guys very much for meeting with us today.
I just want to thank you guys again, and if you have any questions, just get back to us via email. All right, thank you very much.
Thank you.